Ladies and gentlemen, welcome to Blood Health Matters. This is a podcast where I have deep conversations with doctors, which is going to help you gather more knowledge about your blood health, how exactly you can make changes to your day-to-day to achieve a better, a healthier lifestyle, and most importantly, gathering more knowledge and awareness about things that all of us need to know about. Today, we're going to be sitting down with Dr. Sharat Damodar, who's had more than 25 years of experience in this particular field. So just sit back, relax, and listen to every single word that this genius has to say. Good afternoon, doctor. How are you today?
Good afternoon, yeah. Welcome to Bangalore, first of all.
Thank you so much, sir. Is that a question you get often? Do people ask you how you are?
So it's a lesser thing rather than me asking them, So a default when we sit and see patients, the first thing is, come in, how are you? How are you doing? And we know that most of them will say, I'm not doing that great, and that's why I come to you in the first place. Okay. But there is a set of people who, as they leave OPD, will nicely say, so doctor, how are you doing? Are you well? So it's a great note to kind of,
That's wonderful. I'll give you a little context about myself. I'm a very curious person, right? So I've been that kid in school that every teacher used to hate because I would always ask them questions. So by the end of these few episodes that we're going to shoot today, I'm pretty sure you're going to hate me for the questions that I'm going to ask you as well. But all of these questions, they're coming from a very, it's a child's curiosity. Now, because I've got two reasons for it, two very good valid reasons. Number one, I am very concerned about my own health and the health of my parents. I want them to live for as long as possible. I love my parents. And of course, I want myself to live as long as possible as well. I kind of love my life at this stage. And number two is that I see the consumption pattern around the world changing. All of a sudden, people want to live healthier lives. People want to optimize their lifestyle in the best ways possible for them to be able to live longer, number one. Number two, have a better outcome towards their actions as well, be more efficient for that sake. And they know that health has a direct link to them. So, few questions that I have in this episode for you, they are in and around lifestyle and how to stay fit. So, the first question for you, sir, is how closely is our daily lifestyle affecting our health in any way possible?
Yeah, so in today's world, everybody's become so busy that health is kind of becoming a little lower priority.
Right.
Okay? Because you're just caught up with so many things. So if you're not exercising enough, if you're not kind of watching what you're eating, if you're not taking care of simple things like sleep,
right?
Okay, what is required is about 8 hours of sleep, at least 6 hours of sleep if you're really busy. That's something which if I talk to most people, hardly.
Yeah.
Okay. And in today's world, even here you can see we're all full of gadgets, right? So we've got everybody who walk into wherever you go, the first thing you will ask is there Wi-Fi enabled? Is this enabled or something?
Because that's exactly what we do.
Because otherwise you can't kind of survive that day.
Very true.
Now, nature has its mechanism to get back to you when you abuse nature, right? So if you make your entire world totally artificial, somewhere it's going to come back to you.
Wow.
So I really don't know the amount of exposure we have to all these things, living in places which are all generating all of this, what it does to you in the long term. Okay? So that's one of the reasons why we need to focus on that. Nowadays, we see young people coming here to our hospital with heart attack and stroke. So Dr. Shetty says this, earlier days, the children brought their parents to the hospital and said, see, he's my dad, he's got this, and he's had a problem. Today's world, unfortunately, it's the other way around. And we are also seeing it. Elderly parents bringing their children and saying, see, this chap has got this problem. He's not a smoker, no alcohol, nothing. He's such a goody fellow. Why did he get this? Either heart attack or some disease.
Yeah.
And then you go back and dig and say, now, what was he born and had in his 30 years versus the parents' 30 years? Okay? His environment is totally different. There are children who are born with, you're given a cell phone to keep the baby quiet or get the fellow to eat food, right?
Exactly.
Never happened. Okay, now you don't know what it does if you expose somebody to 30 years of mobile
100%.
exposure.
100%.
So that's where we are.
This is health in a general perspective. What's your perspective on how it affects our blood health? Because that is something that people might not know much about.
Correct.
So what role does our diet, our exercise, sleeping pattern, as you mentioned, although a lot of people have very different opinions about sleep, we see a lot of influencers, a lot of creators today. And as you said as well, you pointed out that these children that we're talking about, they are on the social media. They are consuming a lot of content. And they're misguided a lot of times as well, where we have people who are commenting that you don't need 6 hours of sleep, just operate on 3 hours, work, this, that, all of that. So what do you think, say maybe our diet, our exercise, our sleep, stress as well, Does that impact our blood health in any way?
Yes. So coming to blood, because that's my area of kind of specialty and focus.
Yeah.
So, a lot of people will say, oh, you're looking so pale, you're looking so tired out. Just go and take your, blood test and see what is there. Okay. So the commonest cause for all of this is anemia or low hemoglobin.
Okay.
Okay. So one thing is if your hemoglobin is low, then you tend to feel tired because the red cells carry oxygen. And if you have less of them, it does not carry enough oxygen to the heart and the brain. So you feel tired, fatigued out, lack of concentration, lack of sleep, you're more irritable, all of that.
Yeah.
Classic causes in our country, first one is iron deficiency. It may be dietary or it could be worm infestation or it could be blood loss, which is disproportionate. In women, if they have heavy menstrual cycles and bleed a lot, then you would have more blood loss. And that is the commonest cause for anemia in women.
Right.
Okay. In children, it could be just worm infestation and their intake of iron being lesser will produce iron deficiency.
Right.
In adults, sometimes, in men, it could be you have, hemorrhoids or piles and you have some bleeding, you can have blood loss.
Right.
But a lot of times it would be just diet. This is where I'm bringing in diet. Okay. If you're not having enough iron in your diet,
Right.
then obviously your hemoglobin will start coming down.
Got it.
And the typical iron-rich food which we usually have is all leafy vegetables, beetroot, pomegranate, dates, some of the fruits.
Yeah.
Which if you seriously look at it, hardly anybody is taking any of that.
100.
So the favorite seems to be all the fast food, the pizza, burger and all that, which really doesn't have much of all the good stuff.
Of course.
Okay.
I've never seen a burger with yeah.
Okay. The second thing is, in our country specifically, India related, a lot of people are vegetarians and thereby they tend to have vitamin B12 deficiency because B12 is typically found more in dairy and non-veg food. Okay. So otherwise, the pure vegetarian diet does not have enough of B12. Okay. So a lot of the pure vegetarians will come to us again with low hemoglobin and feeling tired and fatigued because of low B12, which is where the easiest thing is to replenish that either with injection or tablet. And similarly for iron, when we give tablets and bring that up.
Right.
So that's from a dietary perspective, what affects your blood.
Right.
The other thing is, blood is also, something which flows everywhere, right? It's also carrying oxygen. And if some part of your blood vessel where blood is flowing gets blocked off, you'll get a heart attack or a stroke. Okay, that's how you get a problem. So somebody who's a hypertensive diabetic, there's, atherosclerosis, thickening of the blood vessel.
Right.
And then if you have very high cholesterol, the viscosity of blood goes up and then it blocks off. So that's another component where blood comes in. And thereby you staying healthy and fit and exercising helps to bring all of that down. Eating healthy food will bring your cholesterol down and thereby your risk of those kind of diseases also come down if you do all of this.
Wonderful.
Which is why we focus on not only eating healthy, but also exercise.
Okay, let's break it down for our audience first. Like you mentioned a bunch of things in this answer of yours. Firstly, I want to come down to this vitamin that you mentioned, B12.
B12.
Now, people have a very big stigma around supplements. People are like, no, I won't have pills. I won't have these extra supplements. What do you think, especially for vegetarians, you mentioned that B12 is a vitamin that is found more in non-veg and dairy.
Correct.
If I'm not wrong.
Correct.
So, what is a solution for these vegetarian people?
So the only source, like I said, if you're purely vegetarian and there's absolutely no choice of non-veg food,
Right.
then curd is a good source. So that's a dairy product which you could use. People who don't mind taking curd is a good source of B12. The only other place where you get B12 is on the brown rice or the red rice. On the outer covering of that is where there's a little bit of B12. Okay. But in today's world of polished rice, you want the whitest rice. It has got no nutrient in that. Okay. You're just shoving some carbohydrate into your system by eating the highly purified rice. So going brown or red or any of the colored rice with more of that coating gives you a little bit of B12.
Wonderful. The other thing that you mentioned was lifestyle habits. Now, I want to know, of course, lifestyle habits, they do affect your blood health directly. What simple lifestyle changes can anyone who's listening to this make that can, number one, help them get a better health? Number two, also get a check of their current blood health. What do I see? For example, if I'm asking you this question, what do I see in my life currently that might indicate that I have poor blood health, number one? And what can I do? What little changes can I bring in my daily lifestyle that can help me correct?
Yeah. So blood essentially has got three components. So the red cell, which carries oxygen,
Right.
okay, in hemoglobin. There's the white cell, which is required to fight infection or your immunity. And then there is the platelet, which allows, clotting to happen when you have an injury. Okay. So whenever the platelet count drops, you have a higher risk of bleeding. Typically, when somebody has dengue, everybody worries about platelets dropping, you go paranoid. You don't want to bleed.
Right.
So these are three components of blood which we want to focus on. The commonest problem coming up is when your hemoglobin drops because of, like what I said, iron or B12 deficiency, then you'll start manifesting as fatigue, breathlessness. So small little things if you notice coming up, then I think you should get yourself checked.
Oh,
And this is nothing great. Just doing a simple blood test or blood count will tell you what those parameters are.
got it.
So that's another thing I advocate for people, saying that once you kind of come into adulthood, you should start doing an annual health checkup. Simple thing to do,
Oh,
you know. So I tell people, on your birthday, go and do a health checkup. You're not going to spend a fortune on that. And the second one is also, if you're gifting somebody something on their birthday, give them one health insurance policy as they
Wow.
post, you know. So you're taking care of yourself and you're taking care of another fellow.
100%.
Both from a health perspective.
100%. This was one of my major goals that I carried into this year as well. That, my parents have not had a very good health background in this past 1 year. So my major goal for 2026 was that, I won't start this year. I won't go into the next quarter without getting them health insurance.
Very good.
So yeah, but yeah, I'm coming to a very big and a very important question for a lot of Gen Z audience who's watching this. Now, what happens because of the internet, of course, that things get normalized. Like if I am getting indulged in a few bad activities, I'll always have someone on the internet who will make me feel good about. For example, if I'm smoking, if I'm consuming alcohol, and if I go ask the internet about that I am smoking, I am drinking, am I doing okay? Is this a bad habit? There, people won't come and tell me bluntly that no, stop doing it. It's affecting your health. There, people will come and tell me, no, it's okay. Little is okay. Want to enjoy, have a good life as well. So, I want everyone to listen from a credible source. That is this really affecting your blood health? Is this really having a very drastic effect on how you could live your life, say maybe after 10, 15 years?
Yes, for sure. So there's an absolute no to both of them.
Yeah.
And clearly both of them will affect your health in the long run for sure.
Yeah.
There's enough evidence for that in today's world. Smoking and lung cancer is something which is very well known. It took some time for that information to come out because of the cigarette industry. So once literature started coming out and publications came up, clear linkage. Now the bigger worry is that even non-smokers now are getting lung cancer. So why does that happen? So there's something called passive smoking. You're sitting next to people who are smoking, and the amount of pollution which is sitting in our world today.
Right.
So in Bangalore, if you go to Silkboard Junction, it's one of the most, high, popular, polluted area, and people have more lung problems and lung disorders in those adjacent areas. Okay. So all this will obviously come back and hit you at some point in time, and there's a clear linkage there.
Right.
So that's an absolute no.
Right.
In addition, smoking also can kick up your blood pressure and then contribute to heart disease and stroke and all of that. So cancer one part, non-cancerous diseases both linked to smoking. Similar data on alcohol. Okay, so there was this great thought that, a glass of wine, Mediterranean lifestyle is a great way to live life. But then you must also look at all the good the Mediterranean fellows are doing in their diet to kind of counter that and then see whether there's truly a benefit there. But otherwise, over a period of time, continuous accumulation of alcohol will hit the liver. There's no doubt on it. And it will affect liver function, and down the line will produce liver dysfunction, which will then go on to produce trouble for you. So both ways, it does affect your health for sure.
Right. 100%. Wow. That's, I'm pretty sure that's an eye-opener for a lot of people watching. One last question before we end this episode, sir. And this is specific to a lot of students, a lot of people who are in their corporate jobs. And me, myself, having a very extensive schedule throughout the entire day, it becomes very difficult to manage a lot of things. And a good diet, a good healthy lifestyle is one. So what would your suggestion be to everyone who's working, everyone who wants to work for a better, healthier lifestyle, but they're not able to just because of their schedule? What would be your personal advice to them?
So I know people are busy, working, I think 10 hours, 12 hours.
Yeah.
So the first thing I tell people when I see some of the younger crowd is, if you're at a desk job, every 1 or 2 hours, just get up and just go around and walk and come. Well, don't say sitting.
Wonderful.
You want to do a Zoom meeting, stand and do the meeting.
Yeah.
You can walk around. Keep a bottle of water. I really try and finish off 2 or 3 bottles, 3 liters of water every day. You may have to go to the washroom, but that's also one way to get you to walk to the washroom. So it's a good thing to do. Get off the chair. First thing. We know you're busy, but then you can also do this parallelly. Food. Obviously, home food is going to be the best. But clearly, there are a lot of people who will not have access to that. You may not get, anything which you can take from home. If you can do that, that's best. If not, small little things like a fruit, some dry fruits, some salad item if you can incorporate in your diet. Just keep a small box with you. Somewhere in between, have a munch of that. Rather than munching on us.
Those fried, yeah, of course.
I know it's easily available.
Yeah.
But please limit. So that's a sincere request and it's doable. Carrying one apple or a fruit is not going to be, too difficult.
Doesn't cost much.
Doesn't cost nothing.
Very.
And then dry fruits are easily available. You just put a few of them, a few walnuts, some, almonds and a few, grapes and some berries are there. And it's a great way to get in antioxidants and stuff which bring your cholesterol levels down.
Right.
Okay. So that gets your food part sorted out. Cut down the amount of rice. So clearly the Indians are huge rice and even wheat that way. Carbohydrate eaters.
Right.
So generally cut down that percentage and try to go up on the protein in.
Right.
So there's enough of vegetarian protein you can have. You can have non-vegetarian protein, which is equally good. We only want to avoid red meat. Otherwise, these are things which are easily doable, even if you have a busy lifestyle. And in that lifestyle, please find half an hour to go and do some workout or play a game or do something.
Yeah.
Don't sit on that chair.
Yeah.
That's all I would say.
That's wonderful because, good for me to hear as well, because this is something that I've incorporated in my own life with my team in my office as well. That, if you have to take calls, if you have to take meetings, get up, get outside the office, go walk and take those meetings. That's number one. Number two, I have a standing desk at my home. So whenever I'm working from home, I am pretty much standing half the time.
Oh, very good.
Number three, I love to work out, but that's something that I'm passionate about. And even if I don't get the chance to work out, like, for example, if I'm traveling today, I'll make sure that I get my 10K steps done for the day.
Okay.
Which is a bare minimum, right? So, I also feel that from all the answers that you've given today, it's also about the mindset that you carry. And it heavily depends on it. Because whatever you've said, it's not very difficult.
Right.
Carrying that bowl of fruits or fruits for that sake, carrying an apple just on your way to the office, buy an apple, 40 rupees won't cost you much. It's all about the mindset. So I hope that everyone who watches this today realizes how important their blood health is. And I hope that they take this choice, not just for themselves, for their families and for their future as well. Thank you for watching.